Thank you for the introduction. The research project that we're working on is a recognition that you cannot solve health leadership problems from a single perspective. So we're looking at developing a simulation lab so students can experience policy, healthcare, and technology all in a sandbox environment. What we mean by that is that in actually working through some of the problems in our research separate from this project, we have found that there's a number of challenges that students will never face in the classroom environment. At least it's quite limited. So the objective, you may not know this, but Ontario has 14 different local health integration networks. And so if you go from location to location, it's hard enough to get your information between your family doctor and the hospital, but if you go to another region, that information is not available at all. Now, from region to region, different services, different policies, technologies exist. So what we're looking to do is to survey all 14 different LHINs and to incorporate policy, technology, and of course the healthcare services into a virtual environment where the students can interact with. So one of those, the primary things is data. How do you get students to work with real sets of data? We have done so much work in actually collecting large amounts of data. There's no way they would have time to do that in a course. We can bring online databases or de-identified local databases. We can give students the ability to work with very large sets of data. So how that works into health leadership is the expectation that in the future, students should have an awareness of all different facets. My background's engineering. I come at most things from a technological perspective, but I learned quite quickly that's only one piece of the puzzle. And we want our students to be able to be more aware, more broadly aware of those problems. So that's what I see, that's what a research project is, to develop a simulation platform. And we're looking specifically through this project to look at the policies, technology, and health services that are available broadly, make an environment available to our students using those in our courses. And in terms of research, it also gives our researchers the ability to explore bigger problems, bigger data sets. Well, what we've found is that the policies related to security and privacy of data, they have spawned technological silos. And when you get out into industry, when you're working either from any perspective, you may not be aware of all the limitations that stop the linking of health data. And then I know in all cases, that's done to protect our information. But there's so much information out there that could be linked that's not. And so if students could study, so the outcome that we expect is that students will have a recognition of policy, of limitations, and that hopefully when they go out into the workforce, they become the leaders who are taking charge of changing policy and linking the technology. Because, as an example, we're studying low-dose radiation, low-dose radiation related to medical imaging and cancer risk. And trying to link that information across different domains has been nearly impossible. It's been over a year of agreements, and it's something that should be addressed sooner